aspect ratio is not quite right on the prompter.
Guys, Paul is here in case there are supply chain questions. So
What is?
we can sit like over there maybe? Oh, you have him there? Oh my God, you have a whole thing. Oh, I'm so happy. Great. Okay, here comes, well, Maria's coming. It's not Tedros yet. Okay.
It's really hard to manage this.
Oh, Maria Nero? Oh my God.
A little bit. Yeah, a little bit. Mics are on. We're live. When we hear they're coming, we start streaming, eh? Abby.
Huh?
Once we hear they're coming down the stairs, we start streaming, so everything's going. Sorry.
So, Ted, oh yeah, tighten your tie.
You do a lot of walking, huh?
I will have a look. We have my line, yeah?
Mic is on. Wow.
Good afternoon, everyone. Thank you very much for watching this regular press conference on COVID-19. Whether you watch it on our Twitter, Facebook, YouTube channel, or you have dialed in, or you're watching through Zoom. Today we have Dr. Tedros, our Director General. We have Dr. Maria Van Kerkhove, and we have Paul Molinaro, who is our Chief for Operation Support and Logistics. We also have Dr. Mike Ryan on the phone, who will be able to answer some questions. Before I give the floor to Dr. Tedros, just two small announcements. WHO has activated its business continuity plan, and this is in order to adhere to good health, public health guidance, as well as to deliver on its mandate. From today, all staff is performing their functions through teleworking arrangements. Only staff whose critical functions can only be performed on the site will have access to this campus. Therefore, there will be no media presence on WHO campus as of today. WHO media team will continue to provide normal services through Skype, email, and phone. Our regular briefings will be virtual press conferences, and our audiovisual team will continue to provide necessary support. So from now on, we will not have a journalist in the room, and then we will inform you if that changes. The second information is that we already sent you the media advisory for tomorrow. WHO European office will convene a meeting, online meeting tomorrow, 17th March, about COVID-19 representatives from the health ministries of the 53 member states of WHO European region. After the meeting, WHO Regional Director for Europe, Dr. Hans Kluge, and emergency experts will brief the press on the current situation in the region, and they will be answering journalists' questions on COVID-19. That press conference will be at 2 o'clock Central European time, and in the media advisory you have details how to access this press conference again tomorrow at 2 o'clock WHO Office for Europe. I'll give the floor to Dr. Tedros for his opening remarks.
Yeah, thank you, Tariq. And good afternoon, everyone. In the past week, we have seen a rapid escalation of cases of COVID-19. More cases and deaths have now been reported in the rest of the world than in China. We have also seen a rapid escalation in social distancing measures like closing schools and canceling sporting events and other gatherings. But we have not seen an urgent enough escalation in testing, isolation, and contact tracing, which is the backbone of the response. Social distancing measures can help to reduce transmission and enable health systems to cope. Hand washing and coughing into your elbow can reduce the risk for yourself and others. But on their own, they're not enough to extinguish this epidemic. It's the combination that makes the difference. As I keep saying, all countries must take a comprehensive approach. But the most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test. Test every suspected case. If they test positive, isolate them and find out who they have been in close contact with up to 2 days before they developed symptoms, and test those people too. Every day, more tests are being produced to meet the global demand. WHO has shipped almost 1.5 million tests to 120 countries. We're working with companies to increase the availability of tests for those most in need. WHO advises that all confirmed cases, even mild cases, should be isolated in health facilities to prevent transmission and provide adequate care. But we recognize that many countries have already exceeded their capacity to care for mild cases in dedicated health facilities. In that situation, countries should prioritize older patients and those with underlying conditions. Some countries have expanded their capacity by using stadiums and gyms to care for mild cases, with severe and critical cases cared for in hospitals. Another option is for patients with mild disease to be isolated and cared for at home. Caring for infected people at home may put others in the same household at risk. So it's critical that caregivers follow WHO's guidance on how to provide care as safely as possible. For example, both the patient and their caregivers should wear a medical mask when they are together in the same room. The patient should sleep in a separate bedroom to others and use a different bathroom. Assign one person to care for the patient, ideally someone who is in good health and has no underlying conditions. The caregiver should wash their hands after any contact with their patient or their immediate environment. People infected with COVID-19 can still infect others after they stop feeling sick. So these measures should continue for at least 2 weeks after symptoms disappear. Visitors should not be allowed until the end of this period. There are more details in WHO's guidance. Once again, our key message is test, test, test. This is a serious disease. although the evidence we have suggested that those over 60 are at highest risk, young people, including children, have died. WHO has issued new clinical guidance with specific details on how to care for children, older people, and pregnant women. So far, we have seen epidemics in countries with advanced health systems, but even they have struggled to cope. As the virus moves to low-income countries, we're deeply concerned about the impact it could have among populations with high HIV prevalence or among malnourished children. That's why we're calling on every country and every individual to do everything they can to stop transmission. Washing your hands will help to reduce your risk of infection, but it's also an act of solidarity because it reduces the risk you will infect others in your community and around the world. Do it for yourself, do it for others. We also ask people to express their solidarity by refraining from hoarding essential items, including medicines. Hoarding can create shortages of medicines and other essential products, which can exacerbate suffering. We're grateful to everyone who has contributed to the COVID-19 Solidarity Response Fund. Since we launched it on Friday, more than 110,000 people have contributed almost $19 million. These funds will help to buy diagnostic tests, supplies for health workers, and support research and development. If you would like to contribute, please go to who.int and click on the orange donate button at the top of the page. We are also grateful for the way different sectors of society are coming together. This started with the Safe Hands Challenge, which has started celebrities, world leaders, and people everywhere demonstrating how to wash their hands. This afternoon, WHO and the International Chamber of Commerce issued a joint call to action to the global business community. The ICC will send regular advice to its network of more than 45 million businesses to protect their workers, customers, and local communities, and to support the production and distribution of essential supplies. I would like to thank Paul Polman, Ajay Banga, and John Denton for their support and collaboration. WHO is also working with Global Citizen to launch the Solidarity Sessions, a series of virtual concerts with leading musicians from around the world. This is the defining global health crisis of our time. The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity. Crises like this tend to bring out the best and worst in humanity. Like me, I'm sure you have been touched by the videos of people applauding health workers from their balconies, or the stories of people offering to do grocery shopping for older people in their community. This amazing spirit of human solidarity must become even more infectious than the virus itself. Although we may have to be physically apart from each other for a while, we can come together in ways we never have before. We're all in this together, and we can only succeed together. So the rule of the game is together. I thank you.
Thank you very much, Dr. Tedros, for these remarks. I will remind journalists who are dialing in by phone, it's star 9. Those who are watching through Zoom, it's clicking raise hand. If it's possible, really, to have one question per journalist, so we can get as many questions as possible from different people. And we will start with Jamil Chade from Brazil. Jamil, can you hear us?
Yes, perfectly. Thank you, Tarek. Hello, Mr. Tedros. My question is about Brazil and about the fact that President Bolsonaro yesterday on the weekend not only helped to call a mass protest in several cities of the country, but also took part himself in one of them. How do you see this as helping or not fighting the virus? And what is your suggestions on protests, street protests, in this case specifically that we are? Thank you very much, sir.
So thank you for the question. What we know that will be helpful during this time of COVID-19 in terms of what the DG just said is everything that we can do to reduce the possibility of transmission between people. And one of the ways that countries are doing this is to stop gatherings together. And some countries have taken different decisions based on the number of people where they've restricted those gatherings. And so it's important that people do restrict themselves, to go to gatherings where there's large numbers of people. And in doing so, that will reduce the possibility that people who come in close contact with one another can potentially transmit the virus to one another. And so taken together with testing and aggressive case and contact finding, it's important that we limit our participation in mass gathering events.
Thank you very much. Just to remind that Dr. Mike Ryan is on phone. Dr. Ryan, if at any time you would like to add something, just unmute your phone and start talking. This time, so we will go for next question, Gabriela. Can we hear Gabriela? Do we have her online?
Yes, hello?
Hi, Gabriela, please go ahead.
Yes. Hi, thank you. Do you hear me? Okay. So I'm Gabriela Sotomayor, Mexico Proceso. My question is regarding Mexico. There are 53 cases and 170 suspected cases right now. But looking at the fatality rate with older people and people with diabetes, for example, in Mexico there are 12 million of people over 60 years old and around 8 million with diabetes. So with this scenario, what measures should Mexico be taking at the moment? Thank you very much.
So I can start with this, and perhaps Dr. Tedros and Mike would like to supplement. The measures that we would advise for Mexico are the same measures that we would advise for all countries. And what we are aiming to do in our advice is reducing transmission for individuals, reducing transmission for young, healthy people, but also reducing the possibility that we are potentially infecting vulnerable populations. We have adequate data now from a number of countries which have shown that people of older age, people above the age of 60, of 70, of 80 years old are at a higher risk of death. We've seen evidence from multiple countries that people with underlying conditions, such as diabetes that you just mentioned, such as cardiovascular disease, such as underlying chronic respiratory disease, are at a higher risk of death. And by reducing the possibility of transmission of yourself, you're reducing the possibility to reach transmission to vulnerable populations. So the measures that we recommend are the same. These are fundamental public health measures. It's testing, as Dr. Tedros mentioned in his speech. It's finding all cases and testing cases, making sure that they are isolated and that they are cared for in medical facility. And if that's not possible, to make sure that they are adequately cared for at home and preventing transmission to loved ones in their household. It's making sure that we have adequate numbers of labs that can test individuals and have testing kits that are available in all countries. It's using the basics, hand hygiene, respiratory etiquette, sneezing into your elbow or coughing into your elbow, coughing into a tissue and then putting that into a closed bin and washing your hands. It's practicing social distancing, making sure that you remain separated from individuals, especially if there are sick individuals. It's staying home if you are unwell. It's working from home if possible. It's mobilizing your populations. All of the same measures that we've been saying every day are the same measures we would recommend for Mexico as we would recommend for every government across the globe.
Yeah, no, thank you. Maria had already said it. The only thing I would like to do is stressing on some of the issues. One, for any country, one of the most important things is the political commitment at the highest level. Because this pandemic is not about the health sector alone. It touches almost all sectors of the government, and the whole of government approach involving all sectors and led by the principal is very crucial. And that whole government approach should also be able to mobilize whole society and make sure that this response becomes everybody's business. Anyone in Mexico, this is, something that can only succeed if all Mexicans actually be involved. This is not just for Mexico, but the whole world. It's everybody's business, and that's what we're suggesting to the whole world, and it will be the same for Mexico. And we hope to see progress in the whole of government approach, whole of society approach, and making sure that this is everybody's business. That's how we can stop this virus.
Thank you very much. Dr. Ryan, would you like to add something?
No, Tarek, I think Dr. Tedros said it right on the spot.
Please jump in anytime you want. I will go now to a question from Norway that we received via text. It's Henrietta Haynes, and I'm sorry if I don't pronounce well. The question is for Maria, and it says, would Maria be able to comment on the new aerosol study and various surface studies, or possibly provide a general update on what do you know today? That's from Henrietta Haynes from Norway, NTB, and The Journal.
So Henrietta, thank you for that question. That highlights the evidence-based nature of our organization and what we are trying to do in terms of making guidance for all countries. And we try to pull together all available evidence on different topics. This one that you've mentioned about the role of virus persistence on surfaces and the potential for the virus to remain in the air. So we are aware of several studies that have been published, that are in the process of being published, and that are currently underway in labs in a number of countries that have looked at different environmental conditions in which the virus could persist, looking at maybe different humidity or different temperature, UV light, and that have looked at different surfaces such as steel, hard surfaces, and looking at the new virus, the new COVID-19 virus, as it compares to other coronaviruses like SARS or like MERS or the common cold coronaviruses that are circulating. And there is a recent study that came out that looked at the role of aerosol generating procedures. How would those viruses, as you know, this is a virus that is transmitted through droplets. And so these are little pieces of liquid that come out of people's noses and mouths if they cough or they sneeze and they talk. And what we know about droplet transmission is that when they come out of an infected person, an individual, is they go a certain distance, but then they settle. And so that's why we have the distance of the 1 to 2 meters apart from individuals. But when you do an aerosol generating procedure, like in a medical care facility, you have the possibility to what we call aerosolize these particles, which means they can stay in the air a little bit longer. And in that situation, in healthcare facilities, it's very important that healthcare workers take additional precautions when they're working on patients and doing those procedures. But for the everyday person, it's the talking and the sneezing and the coughing, which is why we want the respiratory etiquette. So I think I'm speaking too long, but these studies are looking at how long these viruses can persist in the air. And the one study that came out looked at the aerosol generating procedure and said that when you do those, that these particles can stay in the air longer than they would if you were just normally talking to someone. So we use this information to make sure that our guidance is appropriate. And so far, from the available studies that we have seen, we are confident that the guidance that we have is appropriate, which is so people who are in the communities, they don't wear a medical mask unless they themselves are sick, because this prevents them from infecting someone else. But in healthcare facilities, we make sure that healthcare workers use standard droplet precautions, with the exception if they have they're doing an aerosol generating procedure, and then we recommend airborne precautions.
Thank you very much. I think this is very important to provide to our journalists information on what we know. Let's go to the next question. Adrian from Romania. Adrian, can you hear us?
Yes, hello. I'm from Protein, Romania. Authorities in China and South Korea have decided to isolate the areas affected by coronavirus and have managed to reduce the number of infections. But the European Union supports keeping the borders open. What is the best solution recommended by the World Health Organization?
So we recommend that all cases and all contacts are followed. So if with the aggressive case finding and testing of cases, we will know where the virus is. It is important for countries to know where the virus is circulating within their countries and who is infected and who is not infected. By finding all cases and isolating them, providing adequate care for them, by following all of their contacts and testing those contacts to ensure that we find any possibility of onward human-to-human transmission. By doing so, you can effectively stop transmission between people. In addition to that, rapid testing, immediate isolation of individuals so that you're taking them away from other individuals that they can infect. This is the most effective way that we can limit human-to-human transmission. In addition, as what the DG said, is high levels of political support, making sure that there's an all-of-government approach. It's not just the health sector. It's involving all different sectors of the government to repurpose themselves to fight this virus. It's ensuring that every single person in the country, in China, in Korea, in every single country knows what their role is. How can I protect myself? How can I protect my family? What role do I have to play in actually preventing onward transmission? And some of this does involve self-isolation. Some of this does involve making some sacrifices that you don't participate in social engagement. And we've said this before, this is going to be difficult for a while, but this will be temporary. And it's important that we all play a role in this.
Yeah, no, thank you. I have spoken to many ministers from Europe especially, and of course other regions. And one of the areas we have discussed is about testing. And our recommendation from WHO was very, very clear that all countries should be able to test all suspected cases. They cannot fight these pandemics blindfolded. They should know where the cases are and everything about the cases, and that's how they can take decisions. Actually, if they know the cases, then they move into following up with contacts and also isolating the cases, and the contacts would be positive. And not only that, specific to taking care of the specific cases or the positive cases or the contacts, but that can help them also on how they can design their strategy to fight the pandemics. So that was my message to many of the ministers I have spoken to to invest in testing, and that was my speech also today. And going forward, our recommendation is that they have to be able to test all suspected cases and then do everything that should be done starting from the testing or the cases they identify. And in addition to that, we have also discussed about the containment strategy. Of course, we said last week that the situation is already a pandemic proportion, but at the same time, we have said that the containment strategy still holds as the best strategy. And this is because of what we have seen in countries who have made progress. This is in China, South Korea, Singapore. It's the containment strategy that's showing a result, and which we hope can also help other countries to make progress. So we advise countries to stick to testing, and from there, of course, all the steps that they need to do. And we advise countries to stick to containment strategy, because we believe that these epidemics, these pandemics, or this virus is controllable. And the result or the outcome is in our hands.
Thank you very much. Let's go to Tehran.
Tarek, this is Mike. Can I just add something? Please go ahead, Mike. Yeah, no, just and obviously Dr. Tedros has spoken to those high-level contacts and the importance of them. We've consistently said that travel measures, particularly draconian travel measures, are only part of a comprehensive strategy. And countries who rely on travel measures as a way of blocking the virus are just not going to succeed. Rational measures based on risk assessment that restrict travel, particularly for sick individuals, or exit screening, and various measures that can reduce the spread of disease are appropriate in the context of a comprehensive strategy. Many countries have implemented lockdowns and other measures. These are an attempt to try and slow down the spread of the virus. But within the zones that are locked down, that has no impact. And we go back to the same public health measures of trying to suppress infection within a zone. So what can deal with infection within a given zone, and then what can slow down infection spreading between zones, are different types of measures. But relying purely on static travel measures as a means of protecting populations is not enough. It may be useful in certain circumstances, it may have an impact, but it will not have any impact without the implementation of comprehensive approaches. And just one clarification, when we speak about testing all suspect cases, that's extremely important. And when we have identified their contacts, we also need to test any contacts who are symptomatic. Just to be clear, that we're not advising that every contact of every case can or should be tested. We really need to focus on ensuring that when we identify cases, that we exhaustively follow the contacts. And if any contacts are showing any symptoms of disease, they should be immediately tested as well. Thank you.
Thank you very much, Dr. Ran. Dr. Ran is in Ireland calling us from there. Let's go to Tehran. Tehran Times International Daily. Mariam, can you hear us?
Yeah, can you hear me?
Yes, Mariam, please go ahead.
Yeah, my question, I have two questions. Some believe that the number of new cases and deaths reported every day by countries are not real, as some countries might be underreporting intentionally, or some might not test all the patients, especially those with mild symptoms. So is it possible that the number of cases is much higher, therefore the death rate is lower? And I would also like to know if WHO has assessed effectiveness of traditional medicine on treating or relieving the symptoms of COVID-19.
Thank you very much, Mariam. We agree that we will have one question per person. There are lots of questions. I have to apologize right now to journalists that not everyone will be able to ask the question. Maybe, Maria, you want to start?
Yes, And maybe Dr. Tedros and Mike will want to supplement. Yes, there's no doubt that we are missing cases. I think we need to be realistic about this. The reason that we are so aggressive in our statements about finding all cases and testing cases is because we need to know where this virus is. But it is possible that we are missing cases that are on the more mild end of the spectrum. That's normal in an outbreak. It's normal for a respiratory disease, especially because certainly in the beginning of outbreaks, you're focusing on people who seek care. And so that's where people will show up, and they have a higher likelihood of actually being tested for COVID-19 or for any emerging pathogen. So it is certainly possible, and it's highly likely that we're missing cases. What's important is that there are measures, there are processes in place that countries can take to find those cases. And it's important that we don't give up. And we move to a measure to say we're just going to let this happen and we're going to see, hope for the best. Absolutely, we need to be finding all of these cases so that we can effectively isolate them and thus reduce the chances of onward transmission. But ways in which countries are trying to improve that ability to test is increasing their lab capacity. So not only making sure that they have additional kits and tests in their countries, but making sure that they're increasing the number of labs that can test in individual countries, whether it's at the national level or the subnational level or the use of private labs. It's making sure that we have more testing capacity in addition to testing kits. The other question was it relates to traditional medicine. Indeed, there are a number of clinical trials that are currently underway. In fact, it's more than 200 clinical trials, and maybe even more than 300 at the last count. And some of those clinical trials are indeed looking at traditional medicine as it will relieve, if it can relieve symptoms of COVID-19 infection.
Thank you very much. We will go to our next question, and please let's stick to one. Andy Kopsa, can you hear us? Andy was trying to place his question for some time now. Andy, please go ahead.
Yes. Hi. Can you hear me?
Yes, please go ahead.
Okay, great. Thank you. My question is actually about contact tracing, and it's about I'm going back to mid-February and the Westerdam cruise ship that docked and disembarked people in Cambodia. There's conflicting reports here in the U.S. for people that were returning from that ship that there was an actual false positive, and that all of those ship passengers were tested. Can anybody confirm this? We're not getting any answers about whether or not that one person that tested positive was in fact a false positive. Thank you.
I have to mute you. Thank you for your question.
I can't answer to that specific question about that one individual case, but what we can say is that there is the possibility for testing that you may have a false positive or you may have a false negative. And so what we work with across the globe is we work with laboratorians and virologists and clinicians to look at what are the most appropriate biological samples and when in the course of illness, in the course of a contact, should people be tested. And it's important, whether these are upper respiratory samples or lower respiratory samples, the timing in which samples are collected, and then of course the lab test itself. There's always the possibility of a false negative or a false positive, which is why we recommend repeat testing where possible. We know that that's difficult to do because there is a shortage of tests in some countries, but especially for people with epidemiologic links to confirmed cases, it's important that if you have a high suspicion that they are a case.
Really apologies, we have an issue here. Can you please? We are not able to mute you, Andy. Can you mute yourself, please?
Okay.
Sorry, I think we're okay now.
Just to say that if you have a strong suspicion amongst a contact who has an epidemiologic link, which means they've had direct contact with a confirmed case, that you do a repeat sample. And so that you have increase your chances of truly detecting if that person is a case or not.
Thank you very much. Can we go to Xinhua right now? Who do we have from Xinhua Agency?
Hi, it's Liu from Xinhua. Can you hear me?
Yes, please go ahead.
Yeah, the question is the Trump administration has announced a plan to cut deep its global health funds in its 2021 budget proposal. That's slashing more than $3 billion in overall programs, including half of its annual funding to WHO. So how does the WHO think that would help combat the COVID-19? And could you also please give us an idea of how the U.S. has contributed to the global response to COVID-19 so far? Thank you.
Yeah.
Yes, or Dr. Tedros.
What you want to take?
Mike, yeah.
You want me to take, Mike?
I'll go after you, boss.
Yeah, no, thank you. I think the support we're getting for COVID-19, the response is really encouraging. At the initial stage, we were a bit worried, but now we're getting almost close to the funding we asked for, and we expect more support. And the announcement from U.S. Is really significant, and we will expect actually more countries to contribute. But we're almost close to the funding we asked based on the SPRP. Of course, the initial focus was on governments, and we appreciate all governments who have contributed. Now we have already moved to asking contribution from the private sector and all citizens. And as I said in my speech, more than 19 million has been secured actually in a couple of days from the private sector and the global citizens at large. And this is in 2 days, and we expect that this will there will be a significant contribution from the private sector and the global citizens at large. So as we have said, propose for each country to follow or use a whole of government and a whole of society approach, we're using the same thing globally to mobilize all governments to contribute and also all citizens to contribute. And the contribution so far is significant and encouraging, and I know we will get the amount of funding we need. But I would like to use this opportunity, because you have identified U.S. specifically, use this opportunity to thank the U.S. government, other governments, the private sector, and all global citizens for their commitment. We're all in this together. It's a common enemy, and it's our unity that will break this virus. And the last few days I have seen how the human spirit is so amazing, and how it shows us that the spirit can break the virus. So it's not just the funding, by the way. It's the human spirit, which we see, the human spirit that's fighting this virus, which is coming more and more or stronger, that can help us to fight it. When there is unity and solidarity of spirit, and then the resources and other things can come. So I'm really encouraged, especially the last 1 week or so, with the solid level of solidarity that I see.
Yeah. Please, Harry. Yes, please go ahead, Mike. I just want to add, because the U.S. Public Health Service is one of the finest in the world, and not only has served the U.S. well, but over the last 50 years has helps to train and develop public health systems all over the world, field epidemiology training programs, laboratory networks and others. The National Institutes of Health, an amazing platform for primary research, for clinical trials and others. The FDA has been hugely helpful to WHO over the years in regulatory aspects of developing new medicines. And we thank them, all of those institutions, Tony Fauci, Bob Redfield, and all of our colleagues at HHS for their technical and operational support to us and to the world over many, many years, and including in this response. Clearly, we all need to invest more in global public health, in national public health. We're paying a price for underinvestment now, but we need, as the DG said, to come together. Now is not the time to look at that. Now is the time to work together. But we are going to, in future, have to look at how we are investing in public health systems around the world and whether we're actually investing enough. Thank you.
Additional contribution from the U.S. is their scientists and their clinicians who are communicating with us regularly, on the front lines with us in terms of our gathering of information and evidence and sharing of experiences. So we have American scientists and clinicians and public health professionals who are involved in every single one of our technical networks. And so we're very grateful for them, as well as clinicians and public health professionals and scientists from all over the world who are sharing their experiences with us as we learn more about this virus and as that evidence is fed back into our response.
Thank you very much. We are receiving really huge volume of questions, so we'll try to go a little bit to those technical one maybe, because I think this is important. Lara Pinheiro is asking, do we know anything more about children and COVID-19?
This is a good question. We have a lot of questions about children. What we know from the evidence to date is that children are susceptible to infection and that children can be infected with this virus. They seem to be infected in terms of symptomatic infection, in terms of detection through reporting systems at a lower rate than adults, and which is different to what we would see with influenza. And from the evidence that we are seeing, we're not seeing transmission in settings like schools, where we would worry about amplification of transmission. In many countries, schools have closed, and so that is an important thing to take into consideration. We do know that children tend to have more mild infection, have more mild disease, but we have seen children die from this infection. So we can't say universally that it's mild in children. So it is important that we protect children as a vulnerable population. What we don't know right now, and because we don't have serologic tests yet and we don't have the results of these population-based serosurveys, is we don't know the extent of a subclinical or asymptomatic infection in children. And so we're waiting for the results of those, which will help us really understand what role children are playing in this. So just to summarize, we know that children can be infected. We know that they tend to have mild disease, but they can die from this infection, so it's important that we protect them.
Another technical one, maybe if we might, Stéphane here from Switzerland, from Le Temps. He's asking, what do you think about possibility of short-lived immunity and the risk of having a massive wave of COVID-19 next fall?
Is also a good one. These are the same questions we're asking, so these are the right questions. There are some initial studies that are looking at an immune response in individuals. We've seen some studies that have come out that have looked at an immune response in non-human primates. The data is very early. And what we're looking for is whether or not we see a robust response in people and for how long that will last. We're still 11, 12 weeks into this outbreak, and we do have some serologic assays that have been developed in a number of countries. And so we don't have a full answer to this yet, but it is something that is very important to see what level of response individuals have in terms of an antibody response, whether this will provide protection and for how long.
Let's try to get someone online. Our friend Antonio from EFE. Antonio, can you hear us?
Yes, Tariq, can you hear me? So Spain has declared a lockdown to prevent the spread of coronavirus, but today we are still seeing images of overcrowded public transport in cities like Madrid. So do you think societies have to take more seriously the threat of COVID-19? How can we really convince the population to stay at home?
Yeah. To convince the public, first of all, I would like to commend the very courageous and bold action that the Spanish government has taken. I had a chance to speak to Prime Minister Pedro Sanchez, and his commitment, I believe, is really, really strong to fight this virus. But the political commitment at the highest level alone will not be enough. There should be the cooperation of all citizens of Spain. It's the cooperation from all citizens that will make the response actually complete. And I said it many times, this should be everybody's business. Each and every individual should do everything to protect himself or herself and to protect others, and should listen to the advice of the national authorities. So my advice is that this virus will not be stopped without the cooperation of the government, the whole society, and the citizens. This is everybody's business, and I repeat, this is everybody's response and responsibility, and that's how we can stop this virus. And I encourage everybody in Spain to follow the advice of the authorities. Muchas gracias. And my name is Pedrito, my other name. Thank you.
Thank you very much. I will just ask Paul now to give us a little bit an update on where we are with the supply chain and PPEs, as we have been getting some questions, although we didn't get it right now, but a couple of emails came earlier this morning.
Yeah, thank you. As people are aware, we have been facing for several weeks now extreme shortages in the provision of and availability of personal protective equipment for clinical workers and healthcare staff. Also with the demand for greater testing, greater availability of testing, this also puts under pressure the market to supply these tests. And the third area of which we taking a closer look at, and where we see signals of severe market constraint, is around some of the more sophisticated equipment for clinical management. So as we see, definitely, as we've been saying consistently, that continuing to test, continuing to trace contacts is giving a window of time for the clinical system. We start now to see a lot of demand for equipment to manage the wave of patients coming into that hospital system. Is this a challenge? It is. Is it easy? No, it's not. Is there a chance we can get availability and provide this equipment? We remain optimistic. Certainly what we've seen now is a lot of contact being made from Dr. Tedros to highest levels of government and to CEOs. We're certainly looking at a large degree of goodwill from companies and from governments coming forward to unblock the situation. It will, however, take a change in mindset. It's certainly not business as usual. It's very unusual. And if you imagine 1,000 hands with tangled string, it doesn't work to untangle it by competition. It doesn't work to untangle it by oneself. It really needs to take a step back and work together. I think certainly what we've seen over the last 3 or 4 days is the goodwill to untangle it is there. We are making efforts to increase availability in all 3 critical product lines. In lab, we are looking at testing and validating different samples for new reagents from new suppliers to independently validate those. When we have those validated and quality assured, we will move forward and expand the availability of those test kits. So we continue to move forward in that spirit. And thank you.
Thank you, Paul. There was a question from Jason Beaubien from NPR, and he was asking something along those lines. How can we expect countries to test, especially those with the weaker health systems, if even some countries with a more developed system cannot do that?
Again, it's increasing the number of sources. If one imagines the work that's been done up to this time has been quite impressive. It's a new virus with a new genetic, a new genome that then needs to be shared, it needs to be analyzed, it needs to be researched. So the fact that we've managed to get the testing availability that we do have in a number of countries is testament to that will. Now that's a beginning. We have to now seriously scale it up. It needs to become industrialized to a degree. Again, with respecting quality assurance, quality standards, and making sure we are providing the right test for what we need to do.
So I can add to that, if you don't mind. I mean, there's two parts to that question, and Paul has eloquently described this. I mean, one is about increasing the capacity to test, and in increasing your capacity to test, there's three things. There's making sure that you have the labs that are there that can actually do the PCR testing. And as we've said in the past, we are building on existing systems in many countries, and these are building on influenza systems, the national influenza centers that exist in many countries across the globe, making sure that at least one, if not more, labs can do PCR testing for COVID-19. And then within a country, making sure that we look for more labs that can do that testing, whether these are public labs or private labs that can do so. The second is the availability of test kits. And really, we can't emphasize enough how quickly this has come together on the global scale in terms of sharing the full genome sequence very early on in January and having the rapid development of assays by a number of labs across the globe, which has enabled a number of companies, a number of labs to develop PCR tests that are now being shared globally and developed globally. And the third is increasing the people who can actually run those tests in those labs. So what we've seen in some countries is that, you know, we've mentioned this before, that you don't have a uniform outbreak in each country. You may need to move people around your country to support where that need is most. And some of that is increasing your lab capacity workforce to be able to run those tests. But the other part to that question is about the willingness and the efforts to actually go out and aggressively find all of your cases and test your suspect cases and test your symptomatic contacts. It's important that when we say test, this is what we mean. We mean test all of your suspect cases. We mean test your symptomatic contacts. And in doing so, you can drive that transmission down.
Thank you very much. Mike, Dr. Ryan, would you like to add something to that? Or?
No, Tarek, I think Paul and Maria have given very good answers.